Hello, it's Adam Smith-Connor here, physiotherapist at New Forest Physio Clinic. And I want to talk to you today about discogenic back pain. Now, the spine, my plastic spine here, each vertebrae is separated by an intervertebral disc. So the intervertebral disc is this structure here on my plastic spine here. Now, the intervertebral discs are soft and squidgy in the middle and harder on the outside. Think of a donut with the jam in the middle with the sort of harder dough on the outside. Over time, the soft bit in the middle hardens and solidifies, but when we're younger, it's more flexible and thicker. So we tend to be slightly taller when we're younger because we've got nice, thick, flexible discs, these intervertebral discs. As we get older, the discs kind of harden and sort of dehydrate and become stiffer, and we can shrink slightly as we get older because of that dehydration. You've got to think the height of the spine. A lot of that height comes from these intervertebral discs. So with age, they tend to shrink and dehydrate. The other thing to bear in mind is overnight, these discs will, because they're not under compression, during the day we're standing upright, there's compression going down through them, they can shrink and dehydrate and get thinner. Overnight they rehydrate, get thicker again. So you're slightly taller first thing in the morning than you are last thing at night. Now, what can happen, and we've got an example of it on my model here, you see this red blodgy bit on the disc here, that represents a disc bulge. So if we go back to my donut example, if you imagine putting your hand on top of a donut, putting pressure on it, leaning down on the donut, if you press hard enough, the jam will start to squidge out of that donut. And the same thing can happen with the spine. If you get into a poor posture, a classic one is to bend forwards and twist. That can put pressure on the intervertebral disc so that the soft squidgy bit, the nucleus of it, the soft squidgy bit in the middle, will push through and come out as a bulge like we've got here on my model, this red bit on my model. Now, where that bulge goes can determine how much problem it's going to cause you. So if the bulge goes laterally and starts to occlude the space here, I'll try and turn it so you can see it. So out of this space here would come nerves. And if that presses onto those nerves, then you're going to get something like sciatica, where you get severe throbbing pain down the legs. If it's in the neck, so you can get a similar thing in the neck, so up here, where in fact you can see the nerves on here, you can see this yellow thing coming out, that's an example of a nerve root. So if the disc bulges out putting pressure on this yellow nerve root, then you'll get symptoms down the arms. You could get pins and needles, numbness, tingling. If it's very severe, you'll get weakness, maybe even something like a foot drop or a wrist drop. If you get that, by the way, that's quite a severe symptom. You need to get that sorted out immediately. You need to go to A&E. And yeah, so that's nerve roots. If the disc bulge goes centrally into the spinal canal, that can lead to severe problems. That could lead to something called cauda equina, where that's a medical emergency. And one of the signs of cauda equina, basically what's happening is the bulge is pressing onto the spinal cord, and if it's left, it can lead to permanent damage. A symptom of that is loss of control of your bladder or bowel. if you suddenly lose control of your bladder or bowel, and it's not just an infection like diarrhea, but you've got a back pain, then that's something you need to seek medical help. That's the kind of thing you would go to A&E for. Like I say, not if you've just got diarrhea because you've eaten something badly, but if it's a back pain that suddenly progresses into loss of bladder or bowel function, maybe with other symptoms like a foot drop or severe burning down the back of the leg and pain down the back of the leg, then you should seek help. So that's with a bulge. Not this one's a lateral bulge, this red bit here, but if it goes backwards into the spinal canal, then that's a severe issue. But hopefully your disc bulge doesn't press on any nerves and simply goes laterally, and then it will just, I mean, it's still very painful, but it will just cause problems with the spine and back pain itself. Now, a really classic symptom of a disc bulge is a lateral shift. So what happens is the spine should be from top to bottom nice and straight, but if you've got a bulge like we have here, you can see that there, then what this body will do is try and offload it, come a bit closer, and it will push away from the bulge, like so. And you get like a lateral shift. This is a really common thing that I see. And what your body is doing is trying to offload that bulge. Okay, hopefully that makes sense. Yeah, that needs to be treated, basically. We need to try and reduce the bulge, reduce the inflammation within it, and get you back to normal. So if you think you've got a disc problem, I'm sure we can help you here at New Forest Physio Clinic. Just put this down. So the number to call is 023 8008 9120. I'm based in Marchwood in the New Forest, Hampshire, not far from Southampton, and would love to see you, and I'm sure we can help you. Thank you for listening.